Now, as the coronavirus pandemic continues, businesses are contributing to the battle against the pandemic. One of such businesses to provide support to an isolation and treatment center is the Echelon Engineering Limited. As part of its corporate social responsibility, the company has provided free technical support to the intensive care unit of the Elwak Isolation and Treatment Center, presenting the equipment to the facility. The managing director of Echelon Engineering Limited, Charles Adiya Kusi Jr., called on all to adhere to the safety measures and protocols aimed at stemming the spread of COVID-19.
Some documentaries, some stories about the facility online when they were telling the story about COVID. That is how come I got to know that there's a facility over here at Elwak that is housing some of the patients. Yeah, the setup was quite unique because, you know, as you can see, this is made up of tents. It's like a hospital made up of tents.
That is the managing director of Echelon Engineering, Charles Adiye Kusi Jr., narrating how he got to know about the Elwak COVID-19 Isolation and Treatment Center and the need for technical support at the intensive care unit. The decision to accept and provide this task meant Charles and his team had to go into the facility to carry out initial assessment before doing the installation. This, he says, was not an easy choice.
So it was not an easy decision because aside even the fact that we had to do this as a CSR for free, my first concern was entering into an isolation center. I mean, it was quite scary in the beginning, but I had to visit the site to do a survey. And then after doing the survey, after putting on the PPEs, it wasn't easy, the first time putting on the PPEs. And it wasn't easy, you know, accepting to come in contact with people who have the virus.
Deputy Commandant of the facility, Major Matthias Yeli Ahig, explains that the gesture by the company would better assist them to effectively monitor patients and medical equipment at the intensive care unit.
Before the coming of these CCTV cameras, what it means is that as and when you don't and go in, you go and check and then you come out. But you agree with me that even within a split second, anything can happen when you leave the place. But with these CCTV cameras that have been fixed directly to the machines, we can still monitor the equipment from the safe zone, which is the green zone. And when something unusual happens, quickly we dispatch a staff to go in and then do the necessary adjustment or attend to the patient. And then it is in a way giving quality health care to the clients who are on admission.
Major Yeli Ahig also believes this would go a long way to reduce the consumption of PPEs by frontline staff at the facility.
It doesn't rule out the fact that we will still be done in to go and give the medical care, but it has given us the opportunity to still serve the patient extensively and as and when needed. We don the PPE and go in. So to some extent, I even think this initiative will cut down on the consumption rates of our PPEs, because it means that anytime you are done to go in, you have a prior knowledge or idea of what is happening in.
The project, according to Managing Director of Echelon Engineering, cost about 30,000 Ghana cedis.
There are two things that we have to look at if we are doing a job like this. The first is the actual cost, the next is the risk. Now, for a job like this, it's a very high-risk job. And I'm sure there are several companies that have even turned this job down, no matter how much people are willing to pay. I would peg it somewhere around 30,000 Ghana cedis if we're not doing it for free, considering the materials used, the labor, plus the risk.
There have been concerns about some Ghanaians who still believe COVID-19 is a hoax, but Managing Director of Echelon Engineering, who had the rare privilege of entering the facility, called on skeptics to disabuse their minds that the disease is a myth.
You don't even have to go inside to come to that realization. I mean, when you get here and you see the tents and you see the demarcations, nobody will tell you that COVID is real. I mean, it is indeed real. And then, you know, seeing with my eyes, firsthand COVID patients, yeah, it was a real wake-up call that, yes, COVID is real and we all need to play our part in making sure that we drive this virus away.
Major Yeli Ahig further called on other philanthropic organizations and individuals to aid health facility to help eradicate COVID-19 from the country. He promised that The facility would put to good use the camera and also ensure its maintenance.
Well, that's it for the news. But it is your birthday today, Stella Yeboah. You are a bunker based in Accra, and this one is coming from sweet Ifo Antoinette, who lives in Romford, the United Kingdom. I hope that you do have a great time today, and God also blesses you more and more. But that'll be it for the news. Make sure you join us, myself and Gifty on that. Pierre, we're in to review the newspapers next.